Kaur, consultant physician on MFine, and today I will be discussing about blood pressure. The importance of measuring blood pressure, its normal range, how to measure blood pressure, and when is it that you need to seek medical attention with respect to blood pressure. So what is blood pressure? It is the pressure that is exerted by the circulating blood on the wall of the arteries. There are two readings that we see on a BP monitor, the systolic or the upper reading, that is due to the contraction of the heart, and the lower reading or the diastolic reading, which is due to the relaxation of the heart. Both the readings are important. Importance of measurement of blood pressure. It is a vital which is important to measure regularly because we need to understand if there is any asymptomatic hypertension occurring. That is, the person might not have any symptoms, but there might be high blood pressure. So if you do not have any symptoms, even then it is wise to get your blood pressure checked every 5 years. If you are a hypertensive and are on medications with the blood pressure under control, it is important to check your blood pressure at least every 3 months in order to prevent any kind of complications. If there are any kind of risk factors like family history of hypertension, smoking, alcohol, hyperlipidemia or high cholesterol, hyper or hypothyroidism, diabetes, obesity, or if you are on antidepressants, it is important to keep a check on your blood pressure. If there is a reading of high blood pressure occurring, you must have to do a home blood pressure monitoring or ambulatory blood pressure monitoring done at least for the coming 5 days, twice a day, in order to understand if you require any kind of medications. Also, the home blood pressure monitoring is important in order to assess white coat hypertension. So white coat hypertension is when you get a high BP reading when it is checked by your doctor, because you might be apprehensive or tensed. While when you check it at home, the blood pressure reading might be normal because you are at the comfort of your home. So what is a normal blood pressure? The normal range is between 100 to 120 systolic by 70 to 89 diastolic millimeters of mercury. High blood pressure is more than 140 by 90. In hypertensive individuals, we have a target of less than 140 by 90, and if the age is less than 80 years and if the age is more than 80 years, the target would be less than 150 by 90 mmHg. So measuring the blood pressure, before measuring the blood pressure, we need to be aware of certain conditions which can cause raise in the BP readings if done before checking the BP, like exercise or even simple physical activity like climbing stairs, consumption of caffeine, alcohol or smoking. These factors can cause raise in blood pressure, and if you are checking your BP soon after you wake up, there might be a low blood pressure reading. So these factors have to be avoided. How do we measure blood pressure? So for measuring blood pressure, we usually use a BP monitor. That's quite commonly available these days. You can use any company's BP monitor. It should be well validated, calibrated. And you can also cross-check with your clinic BP, that is with this sphygmomanometer, that's the mercury manometer that's available, and cross-check with your BP monitor to be sure that the device is working well. And last but not the least, you can use the MFine BP monitor on your phone and measure your BP in just 30 seconds. So for checking the blood pressure, routinely it is done in the sitting position with your back rested and your arm supported at the level of your heart. With the arm extended and the palm facing upwards. Usually tight clothing or any thick clothing has to be avoided. Thin clothing is alright, but avoid rolling it up very tight. And also it's usually checked on the left arm. It can also be checked on the right arm, but certain BP monitors have it mentioned that it has to be checked on the left arm. So you can also check it on the legs. There are various methods of checking it. So the BP cuff, the size of the BP cuff has to be around 80% of the size of the circumference of the arm. So there are different sizes of BP cuffs that are available. There is a standard size available for infants, for children and for adults. In adults, we do have smaller size cuffs available for the individuals who are underweight, or oversized cuffs available for the individuals who are obese. So it's very important to use appropriate sized cuff in order to prevent any kind of wrong readings. The cuff has to be placed over your arm with the tube over the down side and the lower end of the cuff being around 2 to 3 centimeters above your elbow joint, and the tube going front and downwards over the center region of your arm. So how to measure your BP, or measuring BP using a BP monitor. It's quite a simple and easy technique that is available these days. Just slip in the BP cuff over your arm. Close the cuff, not very tight or very loose, just firm enough to fit over your arm, and the tube has to be going centrally and down facing. You will find either a start or option over your BP monitor. So just place it at the level of your heart and click on the start button. Wait for the BP monitor to check for the reading. It is ideal to be quiet while your BP is being monitored. So once the click sound comes, you will be able to see the readings on the screen. It will be mentioned as which is the systolic blood pressure, which is the diastolic blood pressure, and the heart rate might also be displayed on the screen. Your BP readings can also be saved in your device. Certain devices do have the memory in their storage. Also do remove the batteries once you have used, because that will allow your BP machine to function well. So we will now see how to measure your BP, that is how to measure your BP using a mobile, that is using the MFine BP tracker. So on the home screen you will find the MFine BP tracker. Click on that. You will find a measure option. Click on measure and place your index finger over the camera and the flashlight. You will find a red screen. Keep your finger in the same position, do not move it. So this is quite an easy way to check your blood pressure, where there is no compression of the arm. It is easy, freely available, handy, and gives you the result within 30 seconds. So this is how you will be able to see your BP reading on the MFine app. So when is it that you need to seek medical advice with high BP or low BP? So it is considered high, and you need to seek medical advice when the BP reading is more than 130/90, or if it is lesser than 100/60. There are certain red flag signs or certain symptoms which you have to be aware of and seek immediate medical attention if they occur, like any kind of chest pain, breathing difficulty, headache or heaviness of head, any dizziness, nausea, vomiting, or any slurring of speech, loss of consciousness, or deviation of the face, paresis or paralysis.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.